First, thank you for the agenda. We'll be starting with Sonia Ray on what rights you have as an employee and employer with mental health concerns. Secondly, it's bridging the language barrier with Abdul Shakur, mental health practitioner. Unfortunately, our third speaker, Maxine Spence, as we understand in health and social care, has been called away for an emergency, so she may be joining us, but we hope that during that time we're able to reflect and have some Q&As during that time if she's not with us. And finally, last but not least, we'll be joined by Dr. Tina Mystery, who is the clinical psychologist, also known as a Brown psychologist, who will be giving us indications about challenges for an individual around honor and shame, around reporting any concerns. So this will be sort of the agenda today, and we'll have some Q&As and a roundup whilst we're speaking. My name is Dudley Sawyer. I'm from London Care and Support Forum, known as LCaS. I'm joined by my colleague, Peter Webb, who is also from London Care and Support Forum as well. We're doing this in conjunction with SLaM, which part of the project and running this around the area of mental health and well-being. So I'd like to thank everyone for joining us on this lovely sunny day. I mean, it's not often we get that, but I hope everyone has been able to take it easy and enjoy themselves, keep cool, but also be able to reflect. So the event is based around the area of mental health and well-being, as well as communication, mainly related to the health and social care workforce, who've been working at the front line over the last 15 months. As we know, the pandemic has caused additional pressures and stress. The Right Honourable Jeremy Hunt, MP, Chair of Health and Social Care Committee, said the workforce burnout across the NHS and care systems now presents an extraordinarily dangerous risk to the future functioning of both services. Also, the World Health Organization has mentioned poor communication and management practices is one of the risk factors of mental health. As we know, communication is a component to a healthy state. Having an atmosphere to speak freely and candidly creates a culture of psychological safety. In the UK, 33 or a third of the health and social care workforce are of Black and Asian ethnicity, with English not necessarily being their first language. So the question is, how do you check in with them to make sure they're doing okay? For example, the word stress in Southeast Asian languages doesn't translate well. The word translates actually as tension. How do we overcome these little nuances and fundamentals to the well-being of the workforce? We're also looking at the workforce and their rights during this session as well. So it's really vital that we normalize the conversation about mental illness, as many people are still struggling to find their language to open out about these issues. So as I said today, we're creating a lot more mental health awareness and tackling the stigma with events like this, alongside the creation of the South East London Keeping Well portal, which has been integral to part of the work we've been doing with LCaS. So we're joined by speakers who talk to us about our rights, bridging language barriers, real life experiences, and cultural identity. And I think this will help people have more of an understanding about mental health awareness, but also from a culturally diverse point of view as well. We're going to start off with, before we add in our first speaker, who's going to give us everything we need to know about general rights in the workplace, we're going to ask for a poll for you to sort of respond to first and foremost, and just give us your feedback before we start with our first speaker, Sonia Ray. So as you can see, the poll is more addressing, do you know your organization's HR procedures in relation to mental health? It's something people may not be aware of. Many people are concerned about their own well-being and their physical state and mental state, but no one actually knows their rights when working in their working environment. What do you do when it happens? Now, this is one of the questions that we looked at. It's not just looking just at one facet of this, but as many different facets that occur. And we hope that you have an understanding what happens in your workplace, not just for yourself, but for fellow colleagues and what they would do. Is there a procedure in place? What do you do next? We understand that burnout is really key in this sector. So if you do take time off, what happens from there? We're happy to probably come in the results, which claims about 62% of you are aware of your mental health procedures in your workplace, which is great. And 38% of yourselves are not sure. So I'd like to end the poll and introduce our first guest, Sonia Ray. She's the founder of the Nectar HR consultancy, which works with businesses to deliver bespoke HR services. She has a master's in human resources management. Sonia has worked across the public, private, and non-for-profit sector. She has many years of experience, especially in health and social care, with a range of organizations, large and small. She specializes in areas of diversity and equality, as well as absence management. And so without further ado, I'd like to introduce Sonia, a HR specialist with over 10 years experience in health and social care with concerns about burnout. So Sonia, please come in.
Morning, everybody. Morning, Dudley.
Good morning to you. As I mentioned, I'm sure you're fully well aware of the statement by Jeremy Hunt about obviously burnout in this sector. And working in HR, I mean, a lot of us, as we're saying that some people are aware of it, but they're not sure what to do. So, I mean, my first question to you would be, is if someone has been affected by the anxiety, stress, depression, tension, burnout resulting from work, what would you suggest they do? And I guess a part two of that would, what is the legal sort of standpoint and in regards to this area?
I think that the most important thing is that they need to talk about it with whoever they feel comfortable with. That might be somebody at work, that might be somebody outside of work. If you are feeling that you are experiencing work-related stress, especially, you really need to be talking to your employer about that. So the first step is to talk to your line manager and find out what help and support is available for you as an individual. So we've got best practice in the UK that we should all be following. Sadly, not every organisation does. And whilst that poll was interesting, it's quite sad to see that, you know, a good 38% of people don't know what help is out there for them. Now, there is help available. So you need to be speaking to your line manager, you need to be speaking to your employer, and you need to be telling them how you feel. I have seen plenty of fit notes and sick notes come our way with work-related stress coming into our clients, and that for us is a trigger. So we look at the reason why an employee is off sick, and as soon as we know that it's work-related stress, we have a specific process to manage that. Now, not all employers may do that, but a good employer and best practice is then going to be linking in with the employee if they're off sick at that time, especially having wellbeing meetings and really supporting the employee through that process.
And can I ask, obviously, considering the sensitive nature of mental health, is a staff member entitled to anonymity as well as being this being recorded on their staff records? Because a lot of staff don't want to come forward because of the fact of being named and shamed and being recorded on their actual records. So what happens from there? How do you protect against that?
So, I mean, the first thing is, if somebody comes forward, you know, I've dealt with employees with all kinds of health conditions, from, you know, going through chemotherapy and not wanting anyone to know, to mental health issues or whatever it might be. If they ask for that to be kept confidential, then really a limited number of people should know about that in the organisation, first of all. So that means that it shouldn't be shared with colleagues and things, and it never would be and never should be by the management or line management or HR team. That is really poor practice if it is. In terms of it being recorded on their file, the problem that we've got here is that the employer has a duty of care towards their employee under the health and safety legislation in this country, but also under the Equality Act 2010. A disability is deemed as a protected characteristic. So if you did have an employee that was coming forward with these kind of concerns, it wouldn't actually be fair to not be recording that information in a safe place. Now, in terms of an employee's file, the only people that really should have access to that is the HR team and potentially a CQC inspector when they come in. Nobody else has got access to that, and nobody else should have access to that information. And that information can't be shared with, say, let's say that staff member leaves and goes for another job and we're doing a reference. Sickness information should not be shared. It is very, very poor practice to do that, and we wouldn't be expecting people to be sharing that information. So it's important that an employer does record that, because they need to safeguard themselves as an employer to say, you know, X employee has come forward, has spoken to us confidentially. This is what we've done. This is how we've supported them. And it's kept there in the file. Nobody else should have access to that file, and that information should be kept confidential. So employees shouldn't have a concern about coming forward and it being on their file. It can't be used against them in a negative way because it's a protected characteristic. So they can't be treated unfairly or discriminated against because of it.
And considering the nature of sort of a diverse workforce within sort of health and social care, how would you speak to or deal with people who may be from a culturally diverse background, where maybe English and the grasp of the English terminology can be a concern for them? What would happen? What would you do going forward from there?
Sometimes, Dudley, it's just really simple things like checking in with the employee and making sure that they understand the process, the conversation that you've just had, the support that's available, and asking them to relay that back to you. So, okay, this is what we've just discussed. This is how I summarize it. Do you agree? You know, what is your take on the conversation that we've just had? Are you happy with how I summarize that conversation? Are you happy with the steps that we're going to take? Are you happy with the support? Do you understand? And then another very simple thing to do, and I always do this, is, you know, even if it's an informal meeting, we'll make notes. For example, if it's a return to work interview, if it's a wellbeing meeting, there should be structured notes that are made. We provide kind of bespoke templates for our clients around that. And then we go through that template. We write everything down, and then we ask the employee to confirm that they're happy with all of that. Sorry, I thought you were going to ask me another question then.
No, I will ask you another question, but no, I was just listening to the insight. I mean, so going on from there, can a workplace, and this is now a lot for the employees, can a workplace play a part in being corrosive to our health? And how do you guard against a toxic work environment? Because we know in healthcare, you're dealing not with just the management and your fellow colleagues, but also as well with the people you care for. It could be clients, could be patients. So how would that, which would take effect a lot and which plays a big part on the mental well-being of sort of the workforce. So what would happen from there?
So first of all, I think your question was, you know, can employers play a role in kind of declining mental health? And the answer is yes, they can. It all depends on the culture of an organisation. There's been a very big organisation in the news in the last week, not in health and social care, but another organisation that was all about, we're great with our employees, we've got this great culture, you know, we've got thousands of employees, and actually 60 of their ex-employees wrote an open letter about how their mental health declined when they were working for this organisation. It's really brought them out into the spotlight, and a lot of people are saying, we don't want to work with them, you know, we don't want to buy from them, we don't want to be associated with them. So I think organisations are really starting to see the power of how important it is to treat their employees in the right way. So culture plays a massive part in that. And I think it's the simplest things like, do you promote rest breaks? Do you allow staff to have a lunch break? Is the workload manageable? Have you got a good team working environment? What are the working hours like? Is overtime the exception rather than the rule? And are you leading by example? What are your leaders doing, and how are they kind of trickling that down into their teams? But also, you know, are your management and are your line managers trained to spot the signs and the symptoms. So we've got some blogs on our website, www.nectarhr.co.uk. I'll pop it in the chat in a bit. But there are some signs there to look out for. So, you know, somebody starts.
So I mean, you work in HR and you've actually had a very vast experience in this. So can you give me some sort of the warning signs or sort of poor mental health, or give me an idea of maybe some employers are looking out there, or people looking out for their fellow colleagues? I know you will sort of put in a link in there, because you, on your website, you have got sort of signs for sort of poor mental health. So you can give me an example of what you think is, as you mentioned.
It could be, you know, we'll have a line manager call us and say, I'm worried about somebody, maybe they're in probation or something's just not quite right. And it's like, well, have you had a conversation? You know, have you spoken to them? And actually managers are really, really good at picking this up. But the bit comes when they need to connect it to there is an issue. So it might be a change in appearance and perhaps the way this person is dressing. If someone's always really, you know, well presented at work, and then you notice a decline in appearance, you know, they might always be coming in late to work, they might be snappy, they might not, you know, they might be kind of saying, I feel really overwhelmed, listening out for little words, buzzwords, themes that are happening. Perhaps their performance has taken a dip and this is a really good performer. So it's those really subtle signs, and they maybe are cagey when you're asking them what's wrong. And then this is where you really need to sit down. And I've had this a lot. You know, I've had a manager say, oh, this person's doing this. And we'll hold a very informal meeting. We'll have a chat. And actually what comes out of it is that person is struggling, or there is something going on in their home life, or there is a health condition, or there is something going on that is having an impact at work. At the end of the day, we all spend a lot of our time at work, more than we do than we're at home. And if there's going to be signs of a decline in something, we're going to see it at work. And I just want to go back to what I was talking about the Equality Act and a disability. So it's important to note that we don't make decisions about what is or isn't a disability. That is really for an employment tribunal to decide. But generally, the theme that we've seen is depression, anxiety, stress, work-related stress, issues with mental health would be deemed as a disability under the Equality Act. So I just wanted to clear that up. So you are protected, but it wouldn't be our decision as a HR professional. We'd have to go down a route to establish that.
And so before I sort of open up for Q&As, you also have looked at things of positive things, and I think a lot of employers are probably looking out here, as in, what ways would you suggest to maintain sort of good mental health in your team, and maybe effective ways to support staff and their mental health? So I guess those would be sort of give us some sort of examples of what you would sort of suggest. And as you said, you can send something into the actual chat box as well, which would be great.
So some of it is very simple. Some of it is just having a good working environment, you know, getting on with your team members. If there's issues and concerns, having the conversations, having that open communication. As an organisation, there's a lot that you can do. I think the first thing, and I'm really big on this, and I know I've spoken to you about this before, Dudley, is not to have these generic HR policies that are really just dry and very to the point, and they're not really showing what your organisation is. You need to embed your culture into your policies and processes. So that is really, really important. You need to be looking at things like, what does our sickness policy look like? Do we do return to work interviews? Are we checking in with our staff when they come back from work? And have we got a standard format to be able to do that? Because you can't do a different one with somebody and a different one with someone else. It's got to be the same. Are we talking about anxiety? Are we talking about if they've been to see their GP? Are we talking about has something that happened at work, was that a result of why you were off sick? So that could be a trip or fall, but also your mental health. And are we really making sure that that person is okay to come back to work when they're returning from sick leave? But when they're off on sick leave, are we doing wellbeing calls? Are we linking in with them? Are we telling them what's going on in the organisation while they're away, so that they don't feel that they come back and there's been changes? And then that also, you know, is difficult for people to deal with because they've been off. They've had a difficult time, and then they're coming back and there's been changes and nobody's told them. And again, we can support you with getting those return to work interviews, those home visits, those wellbeings right. but also have you got an occupational health provider that will support you, so that you can refer employees? Do you do stress risk work assessments? Very, very, simple things, lots of little things that you can be doing, but also just embedding it in your culture, making sure people are having the breaks that they need, making sure people feel supported. And just to say that, we work a lot with health and social care clients, and what we've seen in the last kind of like 15 months because of COVID, so not just because COVID has made the workplace completely crazy and it's very, very stressful in health and social care right now, but also people are scared, people are concerned, people have had family members or have themselves had COVID, they've suffered themselves, they've had reactions to vaccines, lots of things because of COVID that isn't necessarily at work, but just generally. So are you doing enough to be supporting your staff around that? And there's some really simple things that you can do. There's lots of wellbeing signposting initiatives, apps that are open out free for health and social care staff. As an employer, do you know where to access these, and are you making sure that your staff have got access to them? Cycle to work schemes, remembering people's birthdays, recognizing loyalty to the organization. The list is endless, but it's really about creating that environment in very, very different ways, through your HR processes, through your procedures, through your meetings, and generally through your culture, and making people feel supported.
I think that's great. I think you've mentioned so many processes and procedures coming in, so I think it's really key. I think it's great the work that you're doing, and please put your information in the chat box, because as we know, it's more than just seeing a doctor or psychologist or psychotherapist, and there is HR elements involved, especially when it comes to your well-being as well. So I think it's been great, Sonia.
Thank you.
We're going to open up a few questions to the audience. I know there were a few questions or points to be raised, and you may have an answer to this, but maybe your opinion as well. There was an element around autistic employers and autistic employees have been discriminated, as they're not sort of disclosed about their diagnosis, as well as knowing what to do if they don't sort of like realize, it's a shutdown and not mental health. And so sort of that line of confusion where people aren't all just lumbered in the same mental health sort of box, and there are sort of different nuances to that.
So funnily enough, I've dealt with an autistic employee this week, actually on Monday. A good employer knows that, so really this should be flagged up at the recruitment stage. And if you have, if you are autistic, don't be scared to be going for an interview and telling them that you need extra time, telling them that you need some reasonable adjustments, and telling them what you need from that. I've back in the day, kind of a good 20 years ago, we used to do a lot of psychometric testing for kind of graduate roles and things like that. If people were dyslexic or they've got autism or whatever else, they're given extra time to do these things. So first of all, it's important to flag that up and let people know. But a good employer should then be working with that employee to look at what are reasonable adjustments, and also getting some occupational health support. So support from a HR professional like me or my team or your HR team, if they can give you that support, depends on what level they're at. And then also linking in to find out what can we be doing to support this person. So I've dealt with an autistic employee this week who's been very open, and although has found it difficult to communicate this to us, we're aware that this person doesn't like to make eye contact, wants to stay in their room on their own, has a very specific way that they want to communicate and be communicated to. And these are all things that we can support on, and that our client is able to then make reasonable adjustments for. So it's very difficult in certain circumstances, like autism. I've dealt with Asperger's, I've dealt with it with a wide range where the individual does find it difficult to communicate. But I think it's about going through the barrier to understand that if I do communicate this to one or two people, I'm going to get what I need here. I'm in the right place if your employer is supportive, and I understand that not every employer is, and that's where you need to be taking a bit more advice, or you need to be talking to your employer about how you're feeling. And what the other thing I would say is, if you feel that you're not getting what you need from your employer, speak to them about it, but also put it in writing, so that you are showing that you are raising your concerns and you are putting it in writing to them, because your employer needs to be responding to that. And there is a risk attached to the employer, for them, a very big risk, if they're not doing that, and if they're then not responding.
Does that then apply in the same breath to discrimination as well, in regards to a lot of people have felt the issue about not being heard, not being seen, because their language barrier, the color of their skin, their culture. And, and according to you, and obviously you work in HR, what would you, have you had a lot of concerns or issues raised around that, especially in the region of mental health as well and their well-being?
Yep, I have. And it's mainly when clients start working with us at the start. So that might be one of the reasons why they've come to an organisation like us, because they need help with something like this. But actually, we recognise that, and we recognise that actually, as individuals, we've got these barriers that are up in our brain. And we train managers on how to overcome these barriers, and how to really, what it boils down to is skill set, and what that individual can or can't do. It's not about the way that they talk or the culture that they come from. It's actually about accepting that. So we see this a lot in recruitment, actually, and we train managers on being aware of these beliefs. Oh, sorry, I've just been muted on mute. So it's being aware of the barriers that might be in your head as an employer or as a line manager, and then an organisation like us will work with you on how to recognise that and overcome that, and put processes in place to make sure that you're not making an employee feel like that. But if an employee does feel like that, like I said, talk to your line manager, talk to your HR team, put it in writing. There is a massive risk for these organisations and these employers if they're not going to act on that, if they're not going to act on the concerns that an employee is raising to them. That's when you see things going more down a tribunal route, and the cost to an organisation of not doing stuff like this is massive. We're talking tens of thousands if it goes down a different route, because I told you that I was struggling. I told you all this. I wrote it all down. I emailed you. You didn't do anything about it. It's a protected characteristic. There's a number of protected characteristics under the Equality Act. Race, religion, so many things, sex, sexual orientation, and these are all covered. And they're covered from day one. So they're covered as soon as you apply to somebody, even for a job. You don't have to be there for 2 years to get certain rights like you do with certain employment rights. These rights are from day dot. So an employer really needs to make sure that they get this right.
It sounds fantastic. I know that you've been giving us so much information, and I love the knowledge, and we probably could speak for a very long time. Just want to ask if anyone wants to ask any questions out there. You can either raise your hand or put something in the chat box if you need sort of specific questions you want to raise to Sonia at all. As well, if you feel you can't speak to Sonia here right now, her information is in the chat box and you can get in contact with her. And let me see, I've got 2 raised hands. Okay. So if you bear with me, it's first Ismail, I believe, is the first person that will ask to come in.
Yes, thank you, Sona. My name is Ismail Rashid. I'm a peer tutor at ELF. My background is cardiovascular clinician. Thank you very much for your presentation. One quick question: to protect for the characteristics on it, when the site manager or the immediate manager are within from the same community who do not believe the characteristics, how do you diplomatically being able to go above them? Because we noticed that some of our staff are having difficulties. They're from Muslim background and the manager are from Muslim background, but the members are disabled, and there's very negative connotation from that community, and they do not recognize some of the LGBTQ right as well. And so there was indirectly comments and not promotionals, and there was some issue. So some of the staff has also left because they were not heard, they were not understand, because they were not that visible the need. Thank you.
So if you feel that the discrimination is coming from somebody of the same religion as you or the same race as you, it doesn't matter. You're protected under that characteristic. You're also protected by association. So, for example, I'm a Sikh, but if in the workplace I was discriminated against because of a misbelief that I was, say, Muslim, I'm still protected under the characteristic. So that's being protected by association. But also another way of being protected by association is, let's say I care for my disabled family member, I'm then covered under the disability protected characteristic, because I may be discriminated against because I'm caring for somebody who is disabled. So by association, or just by belief that I am something that I'm not, I'm still protected. So it doesn't matter if that person says, oh, I'm the same religion as you, I'm not discriminating against you. If the evidence is there and they are discriminating, you are protected against that characteristic under the Equality Act.
Thank you. We've got a second question, I believe, by Bode.
Hi, Sonia. Thank you so much for sharing all your knowledge and wealth around HR within employment. It's been really, really useful. So I'm a business coach and consultant, and I work with a lot of companies across the globe, to be fair. And one of the things that I'm being asked a lot about is, things like health and well-being, and mental health, because it's a big issue now. And you did mention, there's a long list of things that employers should be doing on a regular basis, and as a matter of process, to ensure that their employees are happy to come to work, and they don't obviously feel discriminated or being overwhelmed with things that will affect their mental health and well-being. So I just wanted to know if you could provide or share any sort of ideas on the best ways to build I guess a best practice guide, or you may have a best practice guide, or there might be somewhere where I can get a best practice guide that I can share with my clients to encourage them as well, as part of their growth, to incorporate that within their processes.
Yeah, Bodhi, I mean, it's a very big approach to something like this. So there's lots of different ways that you can be doing this. Mm-hmm. There's, making sure that employees can access and you are signposting them to the right places. Mm-hmm. But there's also, then there's your culture, then there's your policies and your processes. So if I'm somebody that's suffering with a mental health condition, mm-hmm. and I'm picking up that sickness absence procedure, first of all, does it read well? Does it actually make sense to me? Do I know what's expected of me? But also, do I feel supported by reading it, or am I feeling like, actually, I'm just going to be victimized by this? So there's your policies and your procedures, even to just go down to the bare bones of your contracts of employment. And then there's actual supporting the employee. But it'd be good if we could maybe connect after the call and have a chat, and I'm happy to share a bit of information. We've got some trained mental health first aiders in our team as well at Nectar HR. So we know lots of ways that we can be kind of supporting staff, but it's probably like a much longer conversation, but I'm more than happy to go through that with you.
All right, I'll drop you a line now, and then I'll catch up with you after. Thanks again.
I'll pop my email address in the chat, so yeah.
All right, brilliant.
And anyone else wants to get in contact with Sonia, she will have a contact address there. I think we've got one last question before we finish with Sonia. I think she's given up a wonderful amount of time and information. There was a question about I have an autistic person who has asked me if I know of anyone who works in autism and trauma, as they were involved in a serious incident at work 4 weeks ago, and their doctor suspects they have complex PTSD, but the company knows they're autistic, but still no help. I don't know how to support him. How can I advise them?
Okay, so first of all, I don't know. I haven't got much context there about what the serious incident was. Has it been reported? Is the organisation aware? Are they taking any steps to investigate what's happened in this serious incident? Because normally that's the first step that an employer would take. We would fact find and find out what's happened in that serious incident. And if their doctor does suspect that, has that been shared with the employer? But also, is the employer making reasonable adjustments for this autistic employee? So there's probably a lot more that I would need to know before I'd really be able to give some advice here. But what I would say is, get in contact with us. We do offer some free HR slots. We offer free HR health checks for organisations. We can give you some tips and some pointers in these areas. But I mean, it sounds like this person may need some more advice. They need some more support, quite clearly, and they need to be talking to the right people to ensure that their employer is doing what they need to. I mean, I'm not sat here saying employers do it right all the time, because they don't. They don't always know what they should be doing. They're not aware of employee rights. They're not aware of best practice. Sometimes it's just not on their radar, and things like this then happen. But we're here as an organisation, what we're really passionate about is getting out there, especially in health and social care, and really making sure that employers are doing it right, so that they are doing it properly for themselves as an organisation and minimising their risk, but also so that employees are being treated fairly, and they're being treated in the way that, from a legal perspective, but also a best practice perspective. Because when you're treating your employees properly, everything kind of works out: employee engagement, motivation, productivity, the reports and the science behind it is all there. But so many people don't do it right. And it would be sad if we had a scenario like this where the employer isn't supporting the employee. So it might again be another conversation that we need to have offline, and know a little bit more about the scenario before we could actually say who might be able to help this individual.
I think that's really great information there, Sonia. I think if possible, if you want to send Sonia a line, or Sonia, once again, if you leave your email address there, and then hopefully the individual can contact you if they want to speak further, that would be great. And really thank you, Sonia, for joining us and really giving us an insight into the rights of your worker, and obviously employer as well, and tips and tricks and so many things. And I think it's been invaluable, the information you've been giving. And I know that it's a continuing, ongoing sort of journey with the whole pandemic and what's going to come off it, and burnout. So thank you very much for your time, Sonia. And I know you have really doing good work, more of a personalised service. So long may it continue. But thank you very much.
Thank you. Thanks for having me, Dudley. And thank you to everybody. I'm sorry if you've messaged and I haven't looked at it. I will have a look in the chat a bit later on and try and get back to people, but more than happy for anyone to email me. We can support how we need to. Thanks very much for having me.
Thank you.
Thank you. Take care.
Bye. And if anyone does want to actually add any further questions they may not think of now and they want to take up later, they can do. That'd be really great. And we will be able to give or forward that information across to Sonia later on. I'm gonna move on to our second speaker, and I have really been enjoyed in meeting and speaking with this speaker. His name is called Abdul Shakur. He's a mental health practitioner at Mind. He's a Black and Asian and minority ethnic community development lead and link worker across Thameside, Oldham and Glossop. He's also covering dementia, COVID-19, learning disabilities. He has 35 years experience working with the local communities, and he's also a trainer for cultural competence Asian people dealing with things such as autism, LGBT, domestic violence, palliative care. He also speaks 7 Asian languages. And finally, he's received an MBE for his services to the arts. So without further ado, I would like to bring in our next speaker, Abdul Shakur. Thank you very much. And we're sort of looking at areas of bridging the language barrier.
Hi. Hello, good morning. Assalamu alaikum. Bhalo Ashan Kem Cho. Pro Hal Hai. Ki Ai and Jambo Abari Mazuri Sana.
Thank you very much, Abdul. As you said, you've got various languages and you've had a lot of extensive work in the community. So one of the areas, and we brought a lot of people together from a culturally diverse background, is with the notion of sort of like mental health and mental health language and sort of body language as well. So give us an idea of how would you say and what your experience are on how to communicate to maybe someone in the workplace who's maybe not hasn't great command of the English language or their first language isn't English. So what things would you sort of suggest?
Yeah.
Or what have you found?
Yeah, I think first of all, thank you very much for inviting me. English is not my first language as well. So what I notice that when I'm talking in English, merely I'm not communicating, I'm just translating the words which are coming into my mind in my language, which is Swahili, Gujarati. So what I did is in my job or in my workplace, I created kind of an atmosphere like a very friendly, non-threatening type. That if I'm talking about my culture or community, then it shouldn't be seen as that I'm just labeling other people that you are racist or you are not providing services. Merely kind of that you don't have that information, so I am providing you that information. And by that, I divided that there are barriers for community to access the services and barriers for service providers towards Asian communities. And then that was kind of a cultural competence training, very informal way, like sitting for a coffee break and talking about maybe lunch break or just saying hi, hello, and then talking. And that created a kind of a real good atmosphere. And then that's how I approached. Although I'm here like for half an hour talk, my usual talk is 7 hours. And it begins with a British colonial time in India up to Kama Sutra. And well, today we don't have any slides of Kama Sutra.
I think we'll probably have to get the course signed and people to sign in for the 7-hour course. But I think you can give us an idea of some of the things we'll be sort of encountering. You mentioned obviously a lot of cultural barriers, language. Also as well, there is another language barrier of the terminology. And I think when the translation comes from one language to another, a lot gets lost. And sometimes people say in the Western world, the understanding of the culture is lost. So how would you bridge that gap dealing with the communities?
The thing is, the South Asian people, their perception or their thinking around mental health issues is very different than European model of psychology. The main difference is in European model of psychology, it deals with brain, mind, where Asian culture is all emotions are related to your heart. So for example, 55 years old woman can't speak English, going to the GP, even sometimes Asian GPs, they will not understand as well because they are trained in a European model of psychiatry. That woman is maybe saying, my heart is heavy or I've got too much burden on my heart. Now she doesn't need ECG. She is just talking about her worries the way, because she will not say, I have got too much on my mind. She will refer that to heart. So we like relate to heart. So if interpreter there is not trained well in communication and languages or culture, then assessment can go wrong. For example, in one of the questions, the woman might say, insects are crawling in my arms, heads. And it can be seen as a hallucination or some other kind of psychosis. But if she is from northern India, then she is just saying pins and needles. So there are very many things where when people, Asian people are talking about their symptoms, they are more towards somatic symptoms rather than psychological symptoms. Because somatic symptoms, they will talk pain, tummy ache. There are so many other symptoms they will talk. psychological symptoms are, in a way, they think people are often hold cultural beliefs about some conditions and symptoms. A person who is here on marriage ground, he's supporting his family back home, and in-laws, his wife doesn't like it that he's sending money back home, so he has to hide it, working hard, keeping money somewhere else, maybe to a friend's accounts, and then his friend is sending this money on behalf. All these things are bringing stress, but he will not complain because in Hindu faith or Muslim faith, it is my prime job, obligatory job to support my older parents, my sisters and my brothers. So why should I complain? So that's how like service providers needs to understand certain words when they are translating material even. So if they are translating the word depression, in Google translation, the word for depression comes in Urdu is right. There's nothing wrong. But that word is not recognized by community. They have never used this word for depression. So then what in my work, what I did, I started using another word, which is very common, whether Asian people have gone to school, college or not, they are literate or not, but they all know this word. They may not know depression or low mood, but they will know the word tension. So I ask them in my PHQ and GAT7 sometimes, what are your tensions? And then they will give me a list of tensions, and that will cover all the symptoms. So there are certain ways to work with South Asian communities. Engagement is also very important. There are three types. Like if my manager is saying you have to engage with community, so you go to them and talk to them. But I don't go to the community. I will go where that community goes. And they go to temple, they go to mosque, asylum seekers go to church. So I will barber shop and money transfer shop. Money transfer shop. People in Europe may be having a cup of coffee and reading newspaper first thing in the morning. But Asian people are looking WhatsApp chat every morning. What is the rate of pound in Indian rupees or Bangladeshi or Pakistani rupees? Whether they have to send the money or not, but they will check the rate as well. This is the most common practice now. So I made friends with 3 money transfer people, and then very like meeting with them, talking to them. And then when they are sending their message every day to 500 people each on broadcast list, my message is going as well. And then they contact me. Then I've spoken to temple, the priest in church. I'm attending Sunday service. I'm attending temples, mosques, and then imams, making them friend. And they are talking about my work in their sermons. And after prayer, they have given me a room as well. So IAP services are now available in Oldham, in community center, in church, and in mosques and temples.
That sounds fantastic. I mean, you've gone actually beyond bridging just a language barrier, but you've actually gone into the community to actually help that inclusion from just for all the whole healthcare sort of environment. And we're obviously touching on mental health and the pressures of what's happened over the last 15 months. And I can understand people not being able to contact with their families, their loved ones, and also working at home, being under each other's roof. So what suggestions or things would you say you've looked at and how people have coped or helped people to cope during this period?
Yeah, COVID-19, you are right that people had problems and struggling contacting their families and friends and relatives. But the biggest stress was contacting their GP. That was the most important stress, not the family, relatives and friends. That comes after. Because what they were saying to me, that in strict lockdown, if I am face to face in cash and carry or Asda Morrison, giving my money bills to the cashier, and I can't see my GP face to face, why is that? So contacting GP, and then some GPs have made you ring 8 o'clock in the morning, and then half an hour lines are closed. And now hundreds and hundreds of people are ringing, you don't get chance for appointment. Then you ring again next morning, or somebody has done online. How many people, Asian people, first generation, can do online appointment? And that is not true that all Asian people are now living in extended family. There are very many older people living on their own because their children are married, they have moved out, maybe they got job in other towns. So they are alone and they don't know how to do this internet business, how they can book appointment online. So that was one stress. Now other stress was, so then in my work, we did 5 ways of well-being kind of sessions over the telephone and telephone therapy, then regular calls, no waiting list. Waiting list is another thing which are making them more stressed. So during pandemic, when a lady who had a severe problem with the shoulder pain, no medicines were working, and she was keep saying, send me for X-ray or some kind of a scan. I can't sleep, and I really feel like very worried. She was prescribed metazapam 50 milligram. Why was that? I've got 100 people on my caseload every time, 100. 80% are there, they can't speak proper English. And out of 80%, 50% are on prescribed medicine anyway. Well, now she was having a physical problem. So 3% people, when I spoke to 20 people, those who were taking antidepressant, 13 said, don't tell anybody, but I don't take these medicines, they go into the bin because these are making me more sick. So none of my client was ever told that for your mental health or stress or all these problems, lifestyle or diet, they are just on medicine and medicine. So that was the stress. So during lockdown, what I did, I published 3 books in English, Urdu, Gujarati, working with them, talking to them on the phone and asking them their feelings about lockdown, their feelings about this pandemic, and then in poetry, prose, or their views, and then we published that book. And that book was given to them and giving them kind of a Zoom sessions or one-to-one sessions, video call on loneliness, self-awareness, connecting with people, physical exercise, all these things, healthy diet. So that's how I was working with Oldham, because Oldham was the only town in whole Greater Manchester which has this COVID-19 linked worker job. That job was not there in any other area.
Wow, you've been very lucky to have engaged. Obviously, I won't leave here without sort of touching on, I know that you have an MB for the arts. So what other things in your culture and practice would you say are helpful in relieving elements of mental health, tension, and these sort of areas of concern?
Yeah, the thing is, first we need a proper trained interpreters when it comes to mental health. And they have to identify the language of the client. If client is from India, then India, Pakistan, Bangladesh, people speak more than 5,000 languages. If you are traveling in India, every 50 miles, language is different, culture is different, 78 cultures, 11 religions, and more than 30 cults we are talking about. So all these things, so interpreter has to be trained. Second thing is, when we are translating any material in mental health in language, it must have English section as well, side by side. So sometimes literacy is not very high. 23% people can read and write their own language, but they can get help from their younger children when they will read in English, because they can't read that Asian language, British-born Asian, many children, they can't read. So translation has to be like side by side using a common plain language, not academic type of language, not like English is in Shakespeare's type English. Everybody will not understand. You have to be academic to understand all these research reports and the simple language they have to use in. And the words which are used in day to day, if they are translating depression or dementia, they don't have to translate the word depression. They can write the word depression using Asian alphabet. And that is more acceptable and understandable for Asian community. They now know the word depression, what depression is. They don't need to know the meaning of depression. They need to know the symptoms and signs of depression in their language, not that word. So if you put that word, because sometimes those words are not right words, translation is okay, but not acceptable. They have never used this. When it comes to other therapies, waiting list is killing them. It must be a short, like kind of waiting list. In my work only, there is no waiting list. For example, client contacts me and next week he is ready for therapy sessions. Well, then I have to be, these type of work in community engagement has to be flexible work. It's not 9 to 5, Monday to Friday. It doesn't work like that. It has to be a very, very flexible person to engage with the community. Other things is when they are working with South Asian people, they need to know very many things about culture and things. And when I do my training, I get so many questions during my training about Asian people, and the way, what the type of questions, my answers are that. I was asked many times why Muslim men can have 4 wives. So that was the question. And I don't mind whether it's relevant to the work or not, but I will answer that. So there are very many questions. So I was asked on one occasion why Asian woman walks always behind her husband. And I said, maybe Asian men look more beautiful from back. So there are so many questions people ask me. But the main thing is, if anybody wants to understand and they work really with the community, they have to have in their mind the needs and their cultural and religious needs. They have to organize any support group in community. Friday afternoon at 1 o'clock, Muslims will not attend, they go to the mosque. Any other day, any other time is okay. So, all these things, fasting month, they have to, Diwali, Holi. So then I have produced presentations around Eid, fasting month, Diwali, Holi, other African, Kenya and Nairobi festivals. So these are going into my department to my colleagues, and they really like it. And then they ask me questions and then we discuss. So that's how we are working like, and so these are the things they have to consider when working with South Asian young children, women. From 16 to 25 is the high rate of self-harm and suicide attempts compared to Asian young men. Women are more into that, so they have to identify why and how to work with them. Working with dual diagnosis, he's taking drugs and at the same time he's got mental health problem. And if my manager, not said, for example, says, talk to him, raise awareness about heroin or these uh, weeds and things, he doesn't want to know what the harms of heroines are. He knows that. Everybody knows that cigarette can cause cancer, but people are buying. He needs, I have to find out the root cause why he is taking drugs. Because if I am telling the harms of drugs, it will not make him stop taking drugs. Drug is not his problem. He's got other problems which I have to sort out. So that's how I approach. And plus, if I am 67 years old, I have to be a 19 years old when I'm talking to him. I cannot talk to him like a 67 years old person. He will not listen to me. He is the person with Instagram and Snapchat. So I have to be on that level. And I have lived that life in Toronto when I was 19. I used to work on Maple Leaf Garden for organizing concerts for Elton John and Diana Ross. So I know that culture and that way. So I can mix up, but everybody has to be according to the level. If I'm talking to the minicab drivers group or about mental health, I'm talking in their language. If I'm talking to the women's group in Temple, I'm talking in their style and the way. So that's how these barriers can be overcome. Maybe a few things I cannot explain because English is not my language, but you can ask me any question.
It sounds great. And it sounds you've actually evolved and learning cultures and bringing your experience into the modern day life. It's really great for the things that are going on in your world and circle. And I think there's a lot of people who have probably learned a lot from you or are continuing to learn from you. And I really think that's great. If you don't mind, we're going to open up the floor if anyone wants to ask any questions or have any insight of maybe how you've gone about this and how you've managed to keep in communication with the community. And there might be some specific area they may want to ask as well. So if anyone wants to raise a hand or leave a question in the chat box, I'm more than happy to ask a question to Abdul. I think everyone's waiting for your 7-hour event. I've got a raised hand. Ismail, again, if you want to ask the question, please come in.
Yes,
Assalamu alaikum, Brother Abdul. Thank you very much for giving us this wonderful summarized workshops on it and the talk. I totally agreed, and I think I was totally having an inclusion on, especially when you were raising the issue with families and supporting family and knowing the daily rates, not only Indian ones, it also is in East African, from Djibouti to Somalia to Kenya. It's our daily things that we were thinking about it, because the social network doesn't exist, the European system doesn't exist. It's us who are overseas that have to support. And sometimes we don't even have, we call depression and mental illness the disease of Western Europeans, because when you're not even having the basic needs, and when you're having issue with the basics day-to-day life and to support the family, there is no way sometimes that we consider, and then we end up at the end result, that's when we wake up, when the person deteriorated very severely and cannot do the basic activity that he's doing here presently to support his family, to support his neighborhood. That's when we wake up and say, oops, the person is sick, the person is ill. And it's a very taboo subject of soul when it comes to the Eastern African community to deal about mental illness, because there's a connotation of mental illness saying that, oh, the person is not spiritually connected to his God, to his Allah, or to his creator. So that's another thing that we have to also consider when we're talking and when we're trying to approach on a more holistic approach. Thank you very much again. I'm interested, if you could put your detail in the chat, definitely I might touch in base with you outside this meeting. Thank you.
Because it's, you see, Dudley, when we are talking, like, for example, in dementia, there are courses called CST, Cognitive Stimulating Therapy. That course was designed for Indian, Pakistani, and Bangladeshi people. And the course is like working with people with dementia, talking to them, showing them the picture of big buildings in India, like Taj Mahal, or in Pakistan or Bangladesh, or photographs of the food or flags and things. But these courses, not for all Asians, I said we have to develop 2 more courses, one for people from Kenya and one for Uganda, because Ugandan people will not know what nihari is, which is the dish of Indian or Pakistani, but he will know what cassava is. So we have to show him the cassava. We have to show him in Mombasa, the buildings. So then we are developing that course. So we need that kind of different things for different communities. Then we are doing music for dementia. So you are playing Bollywood song, Indian, okay, Qawwali music for Pakistani, Bangladeshi, Tagore's, but for Asian, for Eastern African, for Nairobi and Uganda, you need Michael Jackson's Swahili song, Nako Pia Penda Malaika, and all these things we need in Swahili. Then they will enjoy more, and it will bring their memories back. Kind of, not memories back, but it will help them to have less stress and kind of a depression or anxiety. So these are the things I'm working, that everybody has their own different needs, which we have to understand.
I think it's really great because, as you said, our cultures, we all bring everything different to the table, and there's different cultures and we can relate to. And as you mentioned, things like community, which you're doing a lot of work in local communities, as well as dealing with areas of dementia and other taboo subjects or stigmas, which are not either understood or really raised within some culturally diverse communities. It's good really to address that. I think it's really important, and part of your conversation is bridging the language barrier, but it's bridging the culture. So when someone is in the working environment, they're able to understand why things are done in a certain way, and rather than someone being chastised for that or being spoken to, why have you done this? Just the opening question of, you know, being inclusive and trying to get involved in sharing cultures, which is something which is really lost. So I think it's really great work that you're doing, and I will be sharing it and more insight as well as we continue, especially with the portal that we have. And I know we're not going to give the 7 hours away straight away, but we will probably run an event where we will have more inclusive related sort of literature around, and we'll probably put together a group where people can come together and signpost something, Abdul, and I think that would be great for the future. I think everyone's thanking you for your vast knowledge and probably people are shocked that you probably worked with Elton John and Diana Ross, but I think all of these add to your wide knowledge, as well as being on Snapchat as well. So thank you very much for all your assistance today. It's been really great work, and thank you very much. Please, by all means, people want to get in contact with Abdul as well. I think someone said he did really good as well for your age as well. You're doing very well. So you can be able to get in touch with us, and we will facilitate probably putting something together with Abdul as well. So please do look out for it.
Thirdly, I'm going to send you my small presentation for the next British Black History Month. I have made a contribution of Black Muslims. So from Malcolm X to Muhammad Ali, and that I'm going to send you 25 pages things.
Okay, well, what I'll do is, anyone who did sign up for the Eventbrite, I will send this out to you, and please, you feel free to look at Abdul's 25 pages of information, and there'll be more coming from there. And as you can see, he's very adept in many languages, so there'll probably be translated versions as well. So thank you everyone for really, and thank you Abdul for joining us.
Thank you.
Thank you. And moving forward, we were meant to be joined by another speaker. As I said, in the health and social care, it happens where people get called away immediately, and some people may not be able to attend for one reason or another. And in the meanwhile, whilst we haven't got a speaker here, her name is Maxine Spence. She's a mental health and care worker in social care. She was going to give her sort of lived experience. I don't think she's here, but really about the insight of you all out there as staff, employers, and the workforce, and really your experiences. What we found, and part of the background of why this event has come about, is that LCaS joined up with SLaM to produce a portal for Southeast London, which has got about 60% of cultural diverse sort of background, really creating a portal for the community and the workforce, and really looking at the different nuances that happen within that workplace, that community, and sharing that. So events like this are sort of were born about from it, and we've managed to have really 3 great events that have happened off the back of it, and having speakers such as Dame Elizabeth Anionwu as well, and other speakers on the last event, great authors, and really looking to do more of these engagement events, because we believe that you all have a voice, and engagement is really important. I think one of the things that we were looking at as well, when Abdul said, is that from the portal itself, which I think we'll put in the address, I think my colleague Peter's put in the address in the chat box, I'll try and share my screen. It's to do with the area of having translations available on the portal, having a website which we found was unique, where people felt that someone who looks like me, addressing that topic and that area, not feeling an alien sort of website where they didn't feel they could communicate, and really engaging. And what we found is that not just stopping there, there have been many initiatives off the back of a lot of talk, but this is actually something that has actually been carried through, and we're very proud to really add in the actual website itself and the portal. And with this portal, it's given growth where we can have a platform to share events like this, community events, engagements, translations, signposting people's sort of concerns, also adding into cultures, food, Independence Days, all these above, which we've been able to create. I'll see if I can share, and many of you may have gone onto the actual portal itself. One of the areas that we also have to be aware of is that these portals are there to support you, and the engagement is really, really key. And without the engagement on these portals, we lose the traction of there. So it's all really built up for yourselves. And part of this piece is that we're also asking for further information and engagement of what you'd like to see in going forward. So I'm really going to add in very briefly, if those who haven't seen the actual portal, what we've actually created. If you bear with me whilst I share my screen. Bear with me. bear with me there quickly. Let me just move my screen across. I can find it. 1 second. If you bear with me, I'm just gonna get to the actual site itself. So if you see the screen that we've got here, it's just a welcoming, sort of more friendly site about what we're doing within the South East London Keeping Well website. It's an initiative not just for the staff, but also residential, social care, really covering all the 6 boroughs. Really looking at everything from accessibility, feedback, complaints also available there. Also built around all things to do with the pandemic. We've got contacts here. And also as well, we've got areas where we can got many languages that you can sort of look at. I found this quite interesting when we've looked at it. So we've seen and we've gone to Arabic. So it's there straight away.
I'm coming. Yeah, he gave me, he said to me he'll be popping out. And,
so if you go on mute, please. So we also looked at these.
If we have a way of reaching him, I'll text him that I'm in. And
you bear with me. Hello, sorry. And we looked at things such as language barriers in the community, and we saw it wasn't just 1 or 2 languages. As you see, there's a range of languages that people can go to. As you can see, there's a long list that people can really attend to. We also looked at running events, help, stories, free psychological service, sort of help for bereavement, addictions, domestic violence, sort of like Black and Asian and minority ethnic sort of communities, resources for children and family, financial well-being. We felt that it's really important that it covers everyone. We also created training that's tailored to those in the workplace. For those who are here, who are coming from the social care point of view, the NHS is the main driver here, and most of the time the NHS gets a lot of the resources and information and help for them. What we did is created a platform for both primary care and also social care as well, having sort of related training, MOTs, well-being sort of courses, keeping well, relationships, lockdown easing. All these things are here to support and work related to allow those in the community to jump on and really share thoughts of what's happening. So everything from being work-related support, we've got resources for leaders, local employer-based support, profession-specific support, resources for teams as well. We really are growing this and really are looking for feedback for how we can keep this going. The other thing we realize is the portal is an area to really to create awareness, understanding, relevance, trust, resources, and being different and unique. We found that in this being unique, this hasn't been done before, and beyond the initiative, it's something that's ongoing. And really, we're also trying to keep adapting what we've produced and what can be on offer. So we can signpost news events, we can signpost training in the local community, and it's really working in hand with known as the integrated sort of community sort of services. That means it involves not just the NHS, social care, also the community as well. Everyone can play a part in raising the awareness of our mental well-being, running courses, and as Abdul mentioned before, really showing what people are doing and how they, and the awareness and the different types of languages, cultures, and different types of ways that we're moving around. So I think we'll share this on the website and really get people to give their feedback and come back to us. We also want people to be able to see what can be achieved. There's lots of people say, we can't do this, we don't know where to go. Well, this has really provided a place where people can go. We've got social media on the side as well. So all of this really buys into it. We know there's lots of issues around mental health, and it could be anything from addictions, it could be anything behind it, domestic violence and abuse, low mood, we know long COVID is also a matter as well, relationships, all these things, the lockdown easing, it really play a part. And we think behind all of this, and this is where this all came about, it really plays a big part in really improving us all and our feedback of how we can engage as a community. Really looking further from a culturally diverse point of view, there are stats that are incredibly worrying as a trajectory is the disproportionate impact of the pandemic falls on the Black and brown shoulders, like there are higher rates of mortality to the higher likelihood of financial instability. It means over the next few years, we could see a lethal combination of increased stress, grief, and trauma and discrimination with the sort of demographics. So where do we go to? Who do we turn to? And as we know, it can be a concern about where we turn to in our community. We can't speak to people at home. Can we go outside of the home? Do we find a safe place? One thing that a lot of people have mentioned to me, do we find a place that we can trust? We found that we wanted to provide a place where someone who looks like you is available, somewhere you can go and, as we've mentioned, a call or someone you can engage with. Part of this is there, it's confidential in the service, which we hope is ongoing, but we're not finished yet. And there are always ways of improving. So really applaud for anyone to go on the website and anyone who wants to come get feedback. We'll leave my information at the end, and really also as well, if other events or areas you feel that can be touched on, we'll try and get speakers in who are relevant to you and have a more understanding. And also for those who may want to learn and be educated, we also can provide education for that. So really thank you for everyone for joining for that. So before further ado, we'd like to move on to our final speaker, and I hope she's in the room. It's Dr. Tina Mystery. I hope she's in the room here.
Hi.
How are you doing there?
I'm good. How are you?
I'm very good, and thank you very much for joining us. We've had some wonderful speakers, and we believe now you are the final but last but not least speaker. I really just introduce you. So obviously you're the Dr. Tina Mystery, clinical psychologist, Brown psychologist as well, member of Health and Care Professional Council and British Psychologist Society. And you're part of the South Asian Therapist.org, which was founded in June 2020. And I think it's quickly become the largest South Asian mental health community in the world. You also have the Brownology, which is the weekly podcast where you host and look into, as the doctor, the Brownologist, psychologist, things related to South Asian mental health, and really a passionate speaker, trainer, mentor, and touch on the importance of the cultural sensitivity therapy. So, without further ado, I'm gonna ask you to start. And I guess my first question will be to you, from really a clinical psychologist point of view, what are the challenges you found around the individuals around just addressing the subject of mental health and well-being?
Yeah, it's a big word, isn't it? Mental health. It's loaded, and it's only just recently now that with as a culture or a community, or just in the UK, we've started to really address what mental health is. On ITV, we've got Let's Get Britain Talking, and it's constantly, a language that we're starting to become very, very familiar with. However, on one hand, we're becoming very familiar with the language, a bit similar to what Abdul was sort of talking about. But on the other hand, when it is experienced, when it is within the family, the heightened emotions become very, very present. There is elements of shame. There is elements of, no, this doesn't happen in my family. There is so much denial around the experience of mental health and mental health, as in, we all have mental health, of course, but it's when our mental health becomes somewhat of an issue which stops us from functioning, which stops us from being able to live a life that we want to live. We would call it, along the spectrum of when it becomes almost like an illness. And, all this language is really tricky because I think, like Abdul was talking really well, was it's not a language that, as a South Asian, we grew up understanding or even having any sort of acknowledgement of. It was, you know, from when I was growing up, what I saw mental illness or mental health was Bollywood films of people screaming and crying, or really aggressive, you know, characters on television. That's what mental health was. People being locked up. So our impressions and understanding of mental health is somewhat very, very dated. And, you know, the fact that we can't bridge the two is a huge problem within our society as a whole, but also as a culture. So there's lots of bridging that needs to happen, that actually, you know, that we need to start to really unpick what mental health is. And again, that's complicated, and a bit like what, you know, your previous speakers were alluding to, was that it's not just, you know, a biochemical response. It's not just life events. It's actually so much more. There's so many systemic factors that impact on our mental health. And COVID-19 and this pandemic has been a really great example of how we can start to see how racism, prejudice, you know, kind of financial or poverty inequalities can impact specific communities. And the problem we've got now is that, okay, we know that there are these inequalities occurring, but what are we doing about it? And that's where we're seeing this huge mismatch of kind of people falling through the gap.
You also mentioned, obviously, all these things in the background. So from your point of view, and as a psychologist, I mean, there is a how do people come to you, but we also question is about trust and who to go to, who to speak to, and someone who, as I mentioned, someone who looks like me. What's your take on that then?
Yeah, so again, very unclear as what we know in terms of the research around it. Now, back in, you know, the earlier days when therapy was something that we started to understand as a beneficial tool, as a trainee at the time, when I was looking back into therapist matching, the results were very inconclusive. That back in the day, South Asians or Black people would kind of report to say, actually, we're not sure whether we want to engage with people of our own community, because the biggest gap was confidentiality. That there was this fear that disclosure would happen because, oh yeah, she knows somebody in my community, therefore she's going to go and tell people that this is what I'm experiencing. But actually, we're working really, really hard to let people know that actually, even though I'm part of your community, I'm bound by a code of ethics, and I cannot disclose any information about you or your family to anybody. You know, it's against kind of ethical guidance. It's against, you know, it's wrong, full stop. So there was a level of mistrust with our own community type of therapists. But now, what we're seeing is how actually therapist matching is a huge benefit. So, you know, for example, you gave the example of, you know, the southasiantherapist.org, which is the largest online directory of South Asian therapists across the globe. And that's amazing what, you know, this organization has been able to do. And what we found is, having spoken to people who've gone through statutory services, that they have felt there's been some sort of gap within their experience of therapy. So I've worked with black clients, I've worked with Asian clients, I've worked with white clients, you know, and it's really about trying to get to understand their experiences. And like Abdul was saying, that we have to be very, very mindful of trying to provide a individualized, tailored support. And like he was talking about, was that actually for some of our clients who find it very difficult to access statutory services, like going into a clinic or going into the GP clinic, that's quite difficult. You know, it's not something that they might be used to, or, you know, going into a, you know, psychology practice is something that they just feel they just can't do. And so we have to think as practitioners, but also as services, how can we embed ourselves within the spaces that these communities exist? And I have to say that it's probably one of the hardest things that as outsiders we can do. And that's where I feel like we need to flip the script a bit more. I think that we need to train more Black and Asian therapists so that we show visibility. I think that we also need to get these Black and Asian therapists to be part of communities, to show that, you know, mental health is not just something for, you know, white middle class people, that psychotherapy isn't just for them. And we also need to integrate in the ways in which we provide these services as well. One of the things that I'm really interested in is trying to think about, you know, mind-body approaches. So we look at yoga, we look at Ayurveda, we look at all these different holistic approaches that were used in the East and continue to be used in the East, you know, as terms of kind of healing practices. And I know for a fact that, you know, from my own experience, when I've spoken to my mom and, you know, she struggled with something, she would go to a healer rather than go to a therapist. And I've questioned her about this. And she says, well, that's just how it was done. And she feels more comfortable going to a healer, a traditional healer. She wouldn't feel comfortable going to the NHS or going to speak to her GP about something that she's struggling with. And there's lots of, you know, differences within the cultures that, you know, for many cultures like the South Asian culture, there is this element of external elements impacting the person. So there's this idea that it's God's will, you know, that such and such is happening to me, or that, you know, there's certain things that I can do, for example, fast or do certain rituals or, you know, certain pujas or something to help me process what is happening within my family. And, you know, there's, again, huge differences between individualistic cultures and collectivist cultures. And we have to be really mindful of how people construct mental health within these specific ideas. So as practitioners, we can't go in with this westernized kind of model of healing or westernized model of treatment. And, you know, diagnosis and treatment, again, very allied to the medical model, doesn't often fit with how South Asian or Black communities make sense of their mental health. They actually use a very kind of physical language to express mental distress. You know, as Abdul was saying, that many people will talk about heavy hearts, achy joints and bones. And we've got to think about how do we holistically use models to help us to kind of make sense of mental health for these particular communities. Like, for example, yoga is a perfect example of how, you know, we embody distress within the body itself. That actually we know now, having done tons of research, that yoga is actually a really effective tool to process trauma. Who knew, you know? And we've been practicing yoga for thousands and thousands of years. And it's done in such a way that actually is culturally appropriate for anybody to access, but also with the language of kind of, you know, Sanskrit and the rest of it, that actually it makes sense. It's much more gentler rather than using words or language like distress, psychosis, because those words are hugely alienating and frightening for many, you know, communities where this language isn't second nature.
You touched on the areas of sort of physical impact of psychological distress, and obviously somatization is obviously an area when a lot of people in maybe the workplace who may not speak up may have, you said, ailments or conditions which may come or arise, and especially when it comes to bereavement, when someone has passed, someone all of a sudden feels unwell and it manifests itself in a physical format. So I know you've spoken on this a great deal, so can you also express a bit further on that area as well?
So in terms of kind of like how people experience or kind of embody physical, yeah. So we know that Black and Asian communities are more likely to use, you know, language that attributes their distress within their bodies. And, we talk about that within the kind of literature as bottom-up processing. So it's from the body up. And most of the Western kind of models of psychotherapy use a top-down approach. So what that essentially means is that we use the kind of brain and the thinking and the cognitive elements to make sense of the experiences. So, for example, models like EMDR, which is a widely used psychotherapy approach and a tool to process therapy, actually has very little talking. And the evidence base for this particular treatment approach is very strong. And how it's used is through processing of eye movements. That's one way of doing it. And there's also processing through kind of like bilateral stimulation in the body. So you do like tapping. So the actually therapeutic models are catching up, or are also being a bit more, I would say, open to using the body as a tool. Now, somatic processing therapies have been around since, I'd say, around the 70s. And now what we're finding is that we are integrating these approaches to help us with not only helping people do the top-down processing, but also to use bottom-up processing. So, for our Black and Asian clients, that these types of tools or these type of therapeutic approaches can be one way of healing. It's not the way, only way. And, let's think about our cultures, that we use food as a way to connect and communicate. We use dance as a way to connect and communicate. We use music as a way to connect and communicate. So why are we not using these tools? Art, is another tool that we could be using as a way to express and communicate. So we need to be much more open to the therapeutic approaches that we use within, especially for these communities, and then not be so rigid. Because I think that for many South Asian people and Black people coming into the therapy room, it's a very alien experience. And if we think about traditional healing kind of methods, if we go back to, our roots, there usually was somebody like an elder, a group elder or a tribe elder that you would go to seek advice from. And that advice wouldn't be in the form of, kind of advice giving as in a clinical advice giving, this is what you need to do. It often comes from a place of wisdom. And, this is the thing that I feel like there's a huge gap within the way that we support our Black and Asian clients, is that there's a lack of community or village experience in many ways. One of the areas that I specialize in is maternal mental health. And we know that there is a huge uprising of postnatal depression. And actually the number of South Asian and Black women who are being sadly kind of failed within the maternity systems is because they don't feel contained. And that's a kind of psychological term we use, which essentially is what our tribe, our village, our elders did for us in a very subtle way. So when we are looked after, when we feel like we are safe, that is where we can heal. That is where we do our best work. And when we are at our most fragile, that is when we need our community, our village, our place to go to. We feel most unsafe when we go to somewhere where we don't feel seen, where we don't feel heard, where we don't feel like our culture is acknowledged or respected, and where we see people and our experiences are somewhat dismissed. So we need to start to create spaces like this. We need to start to create spaces where, we feel safe enough to talk about our experiences. And, let's not forget the big elephant in the room, racism. We know it's well and alive in this country. Let's not dismiss that. We need to talk about race and racism. We need to talk about microaggressions with our clients and our communities. We need to educate them on kind of, this is what it could feel like. We know that racial trauma exists within our communities. And there is a fear of speaking up. There is a fear around, being open and honest about our experiences, because often we don't feel safe enough. So, it's great that you've created these forums and these conversations, because we can start to open up about all of those experiences. And as Abdul was, wonderfully, connecting to his history of Kenya and, East Africa, my parents are East African Indians as well. So I really resonated with what he was talking about, that we can't ignore the fact that there was, migration and double migration for many South Asian communities. We can't ignore the fact that partition happened and that all that trauma, it still is embodied within people to this day. And we use this word called intergenerational trauma. We have to acknowledge that the way in which people have adapted, and this is the crucial word I'm going to say, is our communities have had to adapt to live in this country. And we've held on to a lot of the heartache and the distress that we have felt from generation to generation. And what we see now is that for many people who experience psychological distress or who may experience a mental illness, that actually is a consequence of trauma after trauma after trauma after trauma. A great book that I would recommend to people who are interested in intergenerational trauma is by an author called Resmaa Menakem, and he writes about how trauma shapes our communities, and it shapes us to a point where the consequences of trauma become behaviors then become sort of personality traits. And this is when we start to see mental health diagnoses being given to particular communities. So we know that actually there is high representation of Black and Asian people within the severe and enduring mental health groups. Why is that? Why are we not being picked up in the primary care? Why are we not being supported early on? And there's huge gaps within, our training as psychologists that actually link to that. As a trained clinical psychologist in the UK, I live in Birmingham. Birmingham is probably one of the most diverse places in the UK, as is London. I did not get hardly any training around how to support my Black and Asian clients. All of this learning I had to do this by myself. Now, I've got lived experience, so I can relate to much of that. But for my white colleagues who have to do even more work around the experiences of Black and Asian people, and again, we're not a monolith, Black BAME, that word, it's not enough to even cover what we experience as communities. The South Asian community is, as Abdul alluded to, that there's so many languages, so many cultures, so many different kind of nuances that people would have experienced. So where do we even have the time to start to cover that? We have to start with a workforce that is willing to be reflexive and willing to examine and challenge their own biases that exist within our kind of practices. So we have to start from a point by acknowledging that there are huge gaps within our services. There are huge disparities between health outcomes and inequalities.
And that's great. I think the passion is there, and I can actually feel it. We're going to open up for a few questions, so we haven't got long. But one question I want to ask, and you mentioned an area, as obviously generations have integrated into the Western world, we now see people who are Black and Asian who feel trapped in being able to come out, with it be their sexual orientation or be it elements of racism. So being, as you call yourself, the brown psychologist, do you feel you've got more influx from people who look like you coming to you with these sort of subtopics or areas which they can't either go to their community in, or they feel they can't address in the Western world, and they're in limbo? So where do they go? So is it creating a new generation or for people and wanting to speak up and say something because of fear of maybe something happening to them?
Yeah, I mean, one thing that I have to say that is, I am very proud of my heritage and my culture and my communities. And, when I look at what our communities have been through, from migration, partition, all of that stuff, there's one thing that I've noticed is that each generation is so resilient. And I use that word in its true form, that we come together at our times of distress. And that's one thing that's powerful about Black and Asian communities, is we work together when it matters. Now, back in the 70s and the early 60s, you know, there was influx of Black and Asian people coming together, and they created these communities, right? And now we fast forward to 2020, okay, that there are generation gaps between my parents and myself. That's kind of how it is, you know. It's very difficult to bridge that gap. They're not going to understand what I'm going through as a British-born South Asian person. I will obviously struggle to understand what it was like to be a double migrant or a child of a double migrant, and what the racism and experiences were like back in the 70s and 80s. So everybody's going to need a place. Everybody's going to need a place where they feel safe and heard and felt visible. So yes, you are right that we are seeing many more second, third generation South Asians talking about their experiences of being in between cultures, of experiencing this, what we call cultural conflict between the West and the East. But what I'm also seeing is this integration. You know, I talk about New York Italians. I really see that, especially with the Black British community, they've really integrated what Black Britishness means. And that's wonderful, because you can see it in food, you can see it in music, you see it in popular culture. And now, you know, we're seeing this happen within the South Asian community, this integration of music. You know, Bhangra music, for example, is an example of this integration of acceptance of both. And it's a fine line that we're constantly having to straddle, that, yes, okay, our communities do struggle with, you know, for example, coming out as gay or lesbian, or talking about racism, because there still is a lot of fear, there still is a lot of stigma. But all of that fear, all of that stigma, it's not made up, it's real. We genuinely do feel discriminated against in this country. There was overt racism back in the 70s. That's where all of that comes from. And this is the work that I often do with clients, is that this doesn't come out of thin air, these feelings from our parents of, you know, you can't talk about these things, you can't rock the boat, just keep your head down and just get a good education, everything will be fine. They did that because they had to survive. And now we are a generation where actually we have somewhat embedded our roots in the UK and across the diaspora. And now we're edging forward and we're speaking up. We're being braver to talk about the things that maybe our parents couldn't talk about or weren't able to talk about. It is hard, but we have to keep talking, and we have to keep the conversation open, not for our sakes, but for our future generations' sakes. And this is one thing that I talk about very openly. I'm a mother of 2 daughters, and I want my daughters to experience a better mental health care system. I want them to know that there are safe places for them, that they can explore their identity in a safe way, that they are being represented in the media and across, you know, all sectors, that they see themselves, and that, you know, there are going to be places where they will be held and their experiences will be held. So let's not do it for ourselves, let's do it for the future generation, because our ancestors did the same for us.
Thank you very much, Dr. Tina Mistry. So we've really got just 3 quick questions because we're running short of time. We're also going to run a poll as well. But one of the people I want to bring here is Azur, who wants to sort of raise a point. I'm not sure if he wants to speak, or maybe he's I think he was going to speak. Obviously. So I'm going to unmute him, ask him to unmute, and then I want him to sort of raise a point. So please go ahead, sir.
Hello, everyone. Hello, Nadine. Hello, Dr. Tina. Very nice talk, and also very nice talk. Assalamualaikum, by the way. So I'm a Muslim, and uniquely a Muslim trans, and I'm living in the UK. I'm a mental health nurse as well, and a care home manager. So this talk today has been really excellent, because I think we're talking about the things that often are not spoken about. We talk about racism, it does exist, you know, and people, you're talking about the in-between cultures. It's something that many people perhaps haven't really experienced that and really understand what it feels like to be in between worlds. And when you're a migrant, when you're a Muslim living in a non-Muslim country, and then when you're also an LGBT, I can understand all about in between worlds and not fitting into anything. I just want to kind of make a point about the multiculturalism that Abu Shakur made first, because I think there's a lot more to be done. Like we were talking about lack of awareness in everywhere. People don't understand about Eid, about Diwali. We all could do a little bit more about that. And you're talking about the matching people, Dr. Tina, experiencing professionals with the right people. I think it is important for people to feel that they can relate to someone, people of the same color, same religion, perhaps even of same gender identity, and in order for them to really be able to kind of say what they, to share their real concerns. And you mentioned about the stigma about mental health in Asian communities. A few years ago, it took me 6 months before I was able to admit to my family that I was having depression, and until that happened, you cannot have recovery, you cannot have progress, because you can't get the right support from your family, and it's very important. And then talking about support from your community, there's also another aspect that I think perhaps people don't realize. People of different sexuality to kind of the religion, for example, LGBT, Muslim LGBT, whether they are in their countries or even in this country, not only just get excluded by other parts of society, but also get excluded from the same people from the same faith. You can't go to the mosque for fear of frequency. So, and we need to kind of help to kind of see if we can address that as well and get our communities to be a bit more accepting. Because just because I'm LGBT doesn't mean that I cannot practice my faith. It doesn't mean that I cannot worship Allah. If I have the same belief and I believe in my Creator, it doesn't matter. This, everything else is kind of. So, and I think that's kind of a bit more. And lastly, you mentioned EMDR. I think it's important about the EMDR and music and dance and creating the diversity. And I do Bollywood dancing, and I've done that for the last few years. And that was my only therapy from my breakdown, not the antidepressants. And I have during that, and I found that help. Not meditation, not yoga. When you're depressed, you sit down, you couldn't move the whole time. You need lively music, like Asian music, Bhangra music, Bollywood music, get you up and dancing. And yeah, I would like to connect with you to talk about connecting EMDR with Bollywood dancing, because there's a lot of ice in that. So maybe we can connect to that and then work on something. Thank you very much.
So we've got 2 more questions before we go. And Dr. Tina, if you can put the name of the book in the chat box, that would be great.
Sure.
And also as well, I know that you are very busy. You can also send a link to your podcast. I love it. It's very soothing. It's really touched on various sort of topics, and it's a really good listen to. And there's a back catalogue of various sort of areas to really listen to as well. So if you do share that in the group. So I've got whilst you're doing that, I'm going to be running a poll as well, so everyone knows. So if a poll pops up, please just try and address it while sort of we're speaking in the meanwhile. So I'm going to quickly, Abdul, give you a few seconds, because I know you've spoken on various occasions before. So so if you just add in quickly, very quickly.
Well, I would say that I have learned a lot from Dr. Tina today. There is no doubt. I'm not just saying it. It's just from my heart. Jambo,
habari gani?
And Dr. Tina Mistry Malaika. Now, the thing is, Mistry is a very common surname within Hindus and Muslims as well.
Yeah.
And the meaning of the mystery is a person who can fix anything and everything at any time. That person is called mystery. So you have
no pressure.
You can ask Tina, is it the one, mystery?
I've been told, yes, I have been told. I've been told by my husband many times. He calls himself Mystery for a reason. I'm like, okay.
No pressure there. No, I think it's great. And I think definitely there is something more to this. And I think it's been a great event just to showcase in only a small sort of way of what's happening behind the scenes and what can be done. So thank you very much. And we will be doing this again. And I will be sending out a recording of this. And for those who want, we will be updating as well. So I will share some information at the end. So Abdul, sorry to jump off. I've got one last question to go with Ismail again before we let Dr. Tina go, because I know she's also very busy as well. So please, Ismail, please.
Thank you very much, Dr. Mystery. And I definitely could resonate, and I definitely could understand and associate it. And I like this very much, the intersectionalities that you have touched a lot about it, because when it comes to those settings of a space of recovery, and I've experienced therapists that they were not wanted to look about it, my wholeness, because of someone that has been dealing with coming out issues as a gay Muslims, myself as well. There was sometimes saying, why don't you just leave your faith? But my faith is the grassroots. Yeah, and it's been, that's part of the trauma, you know, the psychotherapy trauma about it, which is not helpful about it, you know, and to be recognized, because I know that when I am within among my tribes, within my faith, I cannot be truthful. I cannot be the true person. I have to censor myself. I have to keep it myself on it. I don't have the energy and the courage to. I've tried it in my early 20s, and that was very negative to a degree that I was physically assaulted within the mosque, which I was supposed to be feeling safe about it. So I definitely liked it, and I will definitely keep in touch and review your postcards, and I enjoyed it. Thank you very much again.
Thank you, Ismail.
Honor.
Thank you, Doctor. I'm not sure if your link came through on the actual chat. Yeah, maybe try it again. And well, thank you very much, Dr. Mystery. I think we've learned something new about your name and all the things you can do. But you know, if you want in the group, you can send anything that you'd like, any of your links, or even a link to the, or I can also post it as well when I put it out there eventually with the follow-up regards to the actual recording of this. The link to the network as well, the largest network, if everyone wants to probably access that as well. But by all means, you can get in touch with Dr. Tina Mystery, and she's very insightful and very soothing as well to listen to on her podcast as well, if you want to. So thank you very much, everyone, for joining for the guest speakers. Before I go and round up, we've got to have one or two polls. But also as well, my colleague Peter Webb is going to show, because LCaS and the Care and Support Forum doesn't just support just mental health, but we also look at areas in social care that's happening, things like the vaccine, things from everyday matters as well. So if I really grab in Peter very quickly, if he wants to share his screen, and then and whilst the poll is going on, please answer as best as you can. And Peter, do you mind coming in now and just sharing very quickly?
Hello there. I won't bother to share the screen because we're running out of time. Brilliant morning, very useful. What I will do is I'll put a few things in the chat box. The first one, if I can get the chat box to come up, is we have an event on the 24th about recruitment and retention. So that's recruitment and retention based on value-based recruiting and building cultures within organisations. That's been run for us by one of the Skills for Care locality managers. So that will be very useful. You're also, I'm sure, having a lot of pressure on recruitment at the moment, and the likely compulsory vaccination of social care staff is not going to help, nor the shortage of hospitality staff. We understand that there are two reports that I can link you to. One is from The Guardian and one is from the BBC. But I'm also aware from a meeting earlier this morning that there is a meeting at the DH now to discuss this with representatives of provider groups. So I'm expecting to get some further information, which we'll put on the LCaS website as and when we get it. There's also another thing that's come up quite a number of times. Many of you will have NHS Mail, and many of your organisations will have done DSPT. There is a rumour going around that if you have not completed DSPT by the end of this month, your NHS Mail will be delisted. This is not correct. You will need to, ideally you need to do DSPT, but your email, your NHS Mail will not be disconnected. If you apply for NHS Mail after the end of June, you will not be able to get it without having done the full DSPT. And I'm just copying that. This is a response I actually got on the subject, from a combination of CQC and NHSX this morning. So that's pretty much up to date. I would urge you, if you haven't got NHS Mail, to do NHS Mail and also to do DSPT. The other part of that is that people think that if they've got Cyber Essentials, they don't need to do DSPT. They do. Cyber Essentials is another government initiative, different part of government, and I think that there's been a bit of confusion, but NHS Mail is a very valuable item for you. There's very little else I can say. One word of warning, for care homes, many care homes will have bottles of hand sanitizer by the door. There have been a couple of incidents of residents within the home thinking they're bottles of water and attempting to drink them. So please do make sure that they're not accessible, and forget the fact that they're clearly marked. Remember that those residents probably have dementia or are confused. So, please do be careful. And the Keeping Well South East London portal has been mentioned and shown. There are other portals across other parts of London. IAPT services in general are doing a great job. And most of them have got capacity. So they are there to help you and your staff. And as a manager or an owner, do pass the information on to your staff. It's not just for you, it's for them. And thanks, Dudley. Thanks to all the speakers. Great meeting.
I'm on mute, don't worry. Just before we go, just quickly, just sharing a poll, 3 of them. Do you feel there is a need for more cultural mental health awareness? And I think 94% have responded back that they feel there is. So I feel we all can really see there is something in there for everyone to look at. And then we can continue with more events like this going forward. Also part of our Keeping Well website, South East London, we're also looking for like colleagues from Black, Asian, sort of minor ethnic backgrounds working in social care to take part in maybe 2 or 3 scoping sessions regarding sort of new Keeping Well initiatives of those who are interested. So please, there is an email address there, or if worse comes to worse, you can contact me directly. I will put my email address in the chat box there for everyone to be able to contact me. And I thank everyone really for really coming to this event. It's been really eventful, enjoyable, incisive, and I believe that going forward, really, this is something that can happen again. So I will send out a recording of this event. So don't worry, everyone. Those who registered will receive it. And do let your colleagues be aware. And anyone who's coming in here who's probably too shy to speak, or they've learned something, you can also send and you can see in the chat box information to us where we can sort of facilitate further sessions. And anyone who feels they have a good speaker that will help bridge the gap. I think there's a lot there, as Dr. Tina said and Abdul said, within community leaders and really working through the NHS, social care, and all those on the ground level. I think it's a chance for everyone to join and make a point. And I believe it's something going forward. This is something that's much needed, and creating that voice. And as this has all been about communication and being heard, this is a platform that you're allowed to do that on. So everyone, thank you for joining us today. Have a great day. I'm in London. The sun has gone slightly down, but it's quite warm. So everyone enjoy the most of the day, and take care, and hope to see you again soon. Thank you, everyone.